The Health and Social Care Bill was recently passed into legislation, and one of the key building blocks of that legislation is the issue of pricing of healthcare. I'm joined today by David Bennett, Chairman and Chief Executive of Monitor. David, Monitor's recently undertaken a report looking at the pricing of healthcare. Why did you do that, and what were some of the key findings?
Well, for some time now, the services provided by NHS hospitals to patients have been paid for using something called payment by results. And it allows patients to choose where they go for their care, and then the money follows the patient. And some significant part of all hospital treatment is now paid for in this way. It's a system that has evolved over time, and we wanted to see where things stood today as we take on responsibility alongside the NHS Commissioning Board for doing this in the future. So we wanted to find out what's working and what isn't working.
And are there any sort of key statistics or issues that that report sort of highlights in particular?
There were quite a lot of important findings from the work that was done. It showed that a lot of progress has been made, but the system has been increasingly used to do more than it was intended originally to do. And one of the challenges that throws up is that there's quite a lot of movement around in prices. So something like 40% of all prices change by more than 10% every year. And that creates a problem for hospitals, for example, when they're making decisions about investing in services, if they're not sure how prices are going to change in the future. So that's one of the things we need to look at and see if we can get a greater degree of stability into the system.
And how will this work be used to improve patient care and the quality of the services they receive?
That's a very good question. And this is a bit in the workings of the machine, but it does have a very important impact. So, of course, hospitals have to be paid fairly and appropriately for the work they do, but we also have to have the right incentives for hospitals. So there are ways in which we can use prices to incentivize more efficiency so that more can be done with a given amount of money. We need to have incentives so that the quality of the care is continuously improving. So those are the sorts of ways in which patients should see improvements themselves.
And in terms of accessing the report for the readers and for listeners, what are the sort of the three key points you would like to make in terms of what they should look at or what they should remember?
Well, I think three important points for us are, first of all, a lot of progress has been made, but secondly, there's no doubt there's much more that can be done, particularly around costing. The cost of the services hospitals provide form the basis for the prices that they're paid. We need to get better at working out what hospitals' costs are. And then thirdly, it's a very complex system, so we're going to have to take things very carefully in a very measured way, and we will be consulting very widely as we do that on the basis of the report that we've just had done. And it will undoubtedly take a number of years before we start to see change, but we will be getting there.
David, thank you very much for that. The report has already been published, and we would like to encourage you all to both read the report and its findings, but more importantly, to respond to the questions it raises and participate in the consultation.